How loved ones are affected after someone suffers cardiac arrest. Why magicians report better mental health than other creative groups. And November is Lung Cancer Awareness Month, why experts say more people need to get screened. Welcome to Eye on Health, where we focus on stories that affect your physical and mental well-being. I'm Michael George. We begin with the high-stakes meeting between President Biden and China's Xi Jinping. The two leaders held their first face-to-face meeting in a year in California. They pledged to ease tensions between the two superpowers, and President Biden says they made important strides to combat the fentanyl crisis. The CDC says more than 150 people die every day from overdoses related to synthetic opioids like fentanyl. Former Secretary of Defense Mark Esper, who served in the Trump administration, says President Biden needs to hold Xi accountable. Esper believes China will do a better job this time around because their economy is down and they need U.S. investment. The U.S. remains among the most dangerous developed nations for childbirth. According to a new report from the March of Dimes, more than 10% of births were preterm in 2022. As Naomi Ruckham explains, that's only a slight improvement from the year before.
The preterm birth rate in the U.S. remains near an all-time high, according to the March of Dimes annual report card. Data of preterm births from the CDC finds 10.5% of births happened before 37 weeks of pregnancy in 2021, the highest percentage ever. In 2022, that number dropped to 10.4%, a negligible difference, according to the head of the March of Dimes. The March of Dimes gives the U.S. a D+ grade, and 8 states plus Puerto Rico earned an F. The data also highlights significant racial disparities. Black and Native American women are 54% more likely to have a preterm birth compared to white women. Preterm birth is one of the leading causes of infant death in the U.S., and CDC data shows the infant mortality rate rose 3% last year, the largest spike in over 2 decades. The new report also shows maternal deaths have almost doubled in the United States since 2018. Naomi Ruckham, CBS News, New York.
The CDC is warning doctors to look out for possible cases of lead poisoning in children linked to tainted applesauce and fruit puree. Officials say more than 30 toddlers have become sick, with at least one child having a blood lead level 8 times higher than the level that raises concern. The outbreak is linked to recalled pouches of Wanna-Banna apple cinnamon fruit puree and Schnucks and Weiss cinnamon applesauce. The products were sold in stores and online. According to the CDC, lead toxicity primarily targets the central nervous system, and even low levels have been associated with learning, behavioral, and cognitive deficits. Flu season is here, and we know the virus can make people of all ages very sick, including children. CDC data shows activity levels are starting to creep upward, most notably in the southeastern U.S. right now. New research shows despite recommendations, many children at high risk for flu complications are not receiving treatment. We spoke with the study author about the benefits of flu antivirals. Antiviral treatments can make the flu less severe in children, but new research in the journal Pediatrics shows less than 2/3 with a flu diagnosis receive the medication. Study author Dr. James Antone with Vanderbilt University Medical Center says when taken within 2 days, antivirals can shorten the duration of symptoms by about a day. Oseltamivir, or Tamiflu, is approved for children under 5 and is also recommended for all age groups. National guidelines say all children under 2 should get an antiviral, but the findings show just 37% are prescribed the treatment. Flu activity remains low nationally, but is picking up. Doctors say antivirals can also help prevent transmission. There can be some side effects. Dr. Antone encourages parents to have a conversation with their pediatrician. A popular drug used for weight loss appears to also have benefits for the heart. Experts say it could also help make them more affordable. Chanel Call has details.
New research suggests the weight loss drug Wegovy may be effective at treating people with a history of heart problems. The study from Novo Nordisk, the drug maker behind Wegovy, found it can reduce the risk of heart attack, stroke, or heart-related death by 20%. CBS News chief medical correspondent Dr. John LaPook notes the study had a lack of representation. Nearly 3/4 of participants were men and 83% were white. Still, he says drugs like Wegovy and Ozempic are showing to have a substantial impact on people's health. Medical experts hope this study encourages insurance companies to cover weight loss drugs and make them more affordable. Chanel Call, CBS News.
Dr. LaPook notes that these types of drugs are not meant for people looking to lose just 5 or 10 pounds, and they've not been closely studied in people who are not obese or overweight. Some health experts are worried that their increased use could be potentially harmful to certain patients. Dr. Shauna Levy is the medical director of Tulane's Bariatric and Weight Loss Center. She says people looking to just shed a few pounds should look for other options. Known side effects include nausea, abdominal pain, diarrhea, constipation, stomach paralysis, and an increased risk of suicidal thoughts. There's more proof that cutting back on salt is good for your heart. Scientists at Northwestern University found that when middle-aged and elderly people cut salt intake by 1 teaspoon a day, it was as effective as some medication at lowering blood pressure. And they say cutting salt works even for people who are already on blood pressure-reducing drugs. High blood pressure is the leading cause of death worldwide. This October was the hottest month ever on record across the globe, with the average high temperature more than 3 degrees warmer than the pre-industrial average. According to Japanese and European meteorological agencies, this is the 5th straight month the record was broken, and it puts 2023 on track to be the warmest year ever. There's been more than 570 heat-related deaths in Arizona's Maricopa County, making this the deadliest year on record there. A new study published in the journal The Lancet is warning of worsening conditions if there's continued global inaction on climate change. Researchers say the number of heat-related deaths around the world could increase by 370% by the middle of this century. Dr. Marina Romanello is the study's lead author. She says there's already been a severe increase in deaths over the past 30 years. Romanello says deaths are being caused by poor nutrition, increased parasitic infections, and respiratory diseases, all of which are connected to the warming climate. One solution, according to the study, a healthier, low-carbon diet. Researchers claim that could prevent up to 12 million deaths every year while cutting agricultural emissions from dairy and red meat production. Fewer high school students are vaping, according to a new CDC study. Results from the National Youth Tobacco Survey show the percentage of high school students who currently use e-cigarettes declined significantly during the past year, from 14% to 10%. But the study also showed tobacco use is increasing among middle school students, rising to more than 6% in 2023. Overall, the survey found 10% of middle and high schoolers, that's 2.8 million students, reported they currently use tobacco products, which CDC officials say is concerning. The CDC study also showed that using tobacco products even a few times a month increased the likelihood of developing nicotine dependence. Coming up, there's a new treatment for one of the most frustrating complications that comes with diabetes, and the importance of getting screened for lung cancer. Welcome back. Of the many complications that may accompany a diabetes diagnosis, vision problems can be one of the most frustrating for patients. But doctors believe awareness and new treatment methods are improving quality of life. Naomi Ruckham shares one woman's experience with diabetic retinopathy and her hope for the future.
Donna Brathwaite was diagnosed with diabetes after pregnancy more than 2 decades ago. But it wasn't until 2020 that she noticed her vision starting to change. She was quickly referred to Dr. Yasha Modi, Associate Professor of Ophthalmology at NYU Grossman School of Medicine. Her diagnosis, an advanced form of diabetic retinopathy, a condition that can lead to severe vision impairment and even blindness if left untreated. Diabetic retinopathy affects nearly 40% of patients with type 2 diabetes, and rates of follow-up are lower for racial minorities. When caught in time and with laser treatments and injections, patients like Donna can retain their eyesight. Telemedicine is now an important tool in helping diabetics who face vision impairment. Remote imaging can help screen for signs, even when patients can't make it in to visit with their doctor. Donna makes her appointments her priority. She hopes other diabetics can see themselves in her story and share her outlook on life. Naomi Ruckham, CBS News.
November is Lung Cancer Awareness Month and National Smoking Cessation Month. About a quarter of all cancer deaths can be attributed to lung cancer, making it the leading cause of cancer death in the U.S. A new report from the American Lung Association shows the 5-year survival rate is up 22% over the past 5 years. But there are major concerns over the lack of people getting screened. Just 4.5% of eligible people underwent a low-dose CT scan in 2022. That's dramatically lower than the rates for other cancers, like mammograms and colorectal cancer screening. The American College of Surgeons supported the second annual National Lung Cancer Screening Day earlier this month, hoping to encourage people to ask their doctor about lung cancer screening. For more on this, I spoke with Dr. Timothy Mullett, a thoracic surgeon and the chair of the Commission on Cancer of the American College of Surgeons. After the break, the mental health benefits of mastering the art of magic and the innovative 3D printing technique that's building a better prosthetic. Welcome back. A new 3D printing process has allowed Swiss researchers to create a more lifelike robotic hand. This video of the hand is sped up 400%, but shows dexterity similar to a human hand. A laser scanning technique allows soft, elastic, and rigid materials to be created all at once, allowing for a more delicate structure to be created. The team also uses special plastics that can bend and return to its original shape. It's part of a growing field of soft robotics that are more user-friendly. They believe the design will lead to better prosthetics and eventually have implications for organ and cartilage replacements. The hand isn't ready for use on a human, but they say the 3D printing helps them turn a design into a prototype much faster. A magician's sleight of hand may help them when it comes to really seeing what's not there. Researchers looked at 4 schizophrenia measures in about 200 magicians and found that they not only scored better than other creative groups like artists and comedians, but also better than the general population. Magician Sarah Crasson co-authored this study with Professor Gil Greengross of Aberystwyth University in Wales and Paul Sylvia of the University of North Carolina at Greensboro. They say the public's perception of magicians may be off, and it's a magician's attention to detail that may be driving these results. Magicians reported lower levels in 3 of the 4 schizophrenia traits, including ones linked with hallucinations and antisocial behaviors. Tens of thousands of people suffer cardiac arrests each year. New research highlights the loved ones of those patients can struggle after the event because they are co-survivors. We look at one family's story. It's been 11 years since Jennifer Chapp saved her husband's life. Rick was 56 when he went into cardiac arrest in their home, and she did CPR until help arrived. Rick spent 11 days in the hospital. Dr. Sachin Agarwal with Columbia University Irving Medical Center authored new research that shows most caregivers of people who survive cardiac arrest report some psychological distress, such as anxiety, signs of moderate depression, and PTSD. The study finds access to resources and information can make a difference. The Chapps are part of HeartSight, a website to help families impacted by cardiac arrest. The couple became basic life support instructors after their experience. Jennifer has also taken part in research on co-survivors like herself so more people can also find support. That's all for this week's Eye on Health. I'm Michael George. Thanks for joining us.